At Sentara Comprehensive Weight Loss Solutions Medically Supervised Weight Management Program, our goal is to help you reach your goal. Our personalized program is run by Dr. Christina Cradaville, nurse practitioner Lori Reimer, and physician assistant Tina Penalosa. Dr. Christina Cradaville, the director of the Medically Supervised Weight Management Program, has a passion and interest in bariatric medicine that began while in medical school and carried her into her military career, as well as her work in private practice. She sees the struggles excess weight can create, and she enjoys showing others there are ways to overcome it by setting you up for a successful weight loss journey. To understand more about our program, you first need to realize that obesity is a disease. It's a lifelong, progressive, life-threatening, genetically related, costly, multifactorial disease of excess fat storage. Obesity is defined by your body mass index, or BMI. Doctors consider a normal BMI to be 18.5 to 24.9. You're considered obese if your BMI is between 30 to 34.9, and if your BMI is greater than 35, you are considered extremely obese. So, what causes obesity? There are a number of factors. First, there's genetics. Some people can have a genetic disposition to obesity, and your behavior can influence how it's expressed. That's where the other factors come in. There's your environment. High-calorie, heavily processed food is everywhere, and it's cheap. That's why Americans eat out much more now than we used to do. Then there's sleep, or lack of it. Studies show decreased sleep equates to increased hunger. There are also social influences that can lead to obesity. Social gatherings usually involve high-calorie food and drinks, and in many families, food means love. Maybe you're an emotional eater. You reward yourself with food when you have a bad day and treat yourself with it when you have a good day. Now that you know what can be working against you when it comes to excess weight gain, let's focus on what you can control. That's where our medically supervised weight management program can help. The goal is to improve your current health and decrease your risk of developing comorbid diseases. Even just a 5 to 10% decrease in your baseline weight may improve obesity-related health conditions, like a reduction in type 2 diabetes, improved blood pressure, a reduction in cardiovascular disease risk factors, an improved lipid profile, and even improve your sleep apnea by up to 50%. A 10% weight loss has vast benefits and can improve many conditions affected by obesity, like osteoarthritis, infertility, kidney disease, cancer involving breast, esophagus, stomach, colon, endometrium, and kidney, heart disorders, stroke, impaired respiratory function, urinary stress incontinence, and more. So, why choose the Sentara Comprehensive Weight Loss Solutions Medically Supervised Weight Management Program? Our team is dedicated to helping people manage obesity. We know this is a long-term disease that is not going to be treated with a quick fix. We offer long-term solutions to overcome your obesity. The goal of our individualized assessments and plans is to help you reach your goal. We involve your whole care team in the journey and closely monitor other medical issues as you achieve weight loss. Bariatric surgery is a part of our team. We also have compassionate providers, nurses, medical assistants, and patient coordinators. We will provide you with the support, accountability, education, and resources you need to help you on your journey. We have all the tools you need to help you reach your goal under one roof. Our facility has the latest cutting-edge treatment options, a weight loss store, dietitians, psychology, exercise physiologists, and even surgery options if needed. We're with you every step of the way on your weight loss journey. We offer support and accountability. We do that through frequent office visits to monitor your progress. This isn't just a diet plan. We see you as a whole person. We help you identify those small adjustments you can make that lead to big results. Setting achievable goals and reviewing them at every visit helps to ensure that the meal tracking plan we designed specifically for you is working for you. Through education and our vast resources, we will help you establish a foundation of knowledge you can build upon. We'll help you cut through all the noise out there about weight loss and healthy living and help you figure out what works for you. We'll provide you with answers to your questions, or we'll help you figure it out together. We'll help you start thinking about food and consumption in a new way. Through our library and your Sentara My Chart, you will have an extensive bank of resources to utilize right at your fingertips. Once you're ready to make an appointment, just call our office and we'll get you the new patient paperwork you need to fill out before arriving. Once that's done and your visit is scheduled, be sure to arrive 1 hour before you are set to meet with the provider. That will allow time for several tests, like an EKG and breathing test to be done to give your provider more information to help create an individualized meal plan based on your metabolic rate. You and your provider will discuss food tracking as well as review your history, labs, and studies to determine if more evaluation is needed. You will also talk about possible medications that may be considered for you at future appointments. Your second visit will take place a few weeks after your first to give you time to work the plan your provider created with you. This is when you'll review how the plan is going. You'll look at how your food journal is working out. You'll go over what's working for you and what's not. You'll discuss any new labs or studies you may need and consider whether you may need to add medications. You'll work with your provider to go over the information and develop or modify your overall plan if necessary. There are a few things you need to keep in mind. While each provider may have a different approach, you need to remember that we are all working together to provide you the best care. We mean it when we say our goal is for you to get to your goal. We want you to be medically healthy when it comes to BMI, body fat percentage, and abdominal circumference. We realize everyone's goals are different, and that's okay. That's why we help you create a plan that is individualized for you to reach your goals. Once you do reach your goals, we'll work with you on a maintenance plan. You may also be able to increase your calorie intake by a certain percentage. We'll see how that goes for you for about a month. At your next appointment, we'll repeat the breathing test and determine your new metabolic rate. We'll also repeat your EKG and your labs to look at your overall health, and if you're still at your goal, we'll set an appointment for 3 months. The typical appointment schedule, once you've reached your goals, is 3 months, 6 months, and then an annual appointment. At each of these appointments, we'll evaluate your progress and help keep you on track. It's important to note that once you are our patient, you are always our patient. And if you gain weight on the plan, we'll help you get back on track. We'll understand that there is an ebb and a flow expected. It's part of your journey. We're not going to give up if you don't. If at any point in the journey, you gain more than 3 to 5% of your weight loss back, we'll recommend coming back so we can get you to your goal weight and, more importantly, help you figure out how to stay there. It may just mean your body's metabolism needs a different tactic. Remember, 5 to 10 pounds is a lot easier to lose than 50 to 100 pounds. When it comes to medications to help you on your journey, there are plenty to choose from. We will help you sort it out to determine if medication needs to be part of your journey, and then to help you decide which one is right for your individualized plan. While getting a meal plan in place that works for you may be the most important part of your journey, we know that exercise is another very important element. That's why you will have 2 visits with our exercise physiologist. They will be able to evaluate you and give you a personalized training session that will help you figure out how exercise works best in your life. You'll discuss the importance of thermogenesis, which is non-exercise activity time, as well as calisthenics and weight-bearing exercises. We'll also look at your overall cardiovascular fitness and dispel the myth of burning calories to consume more. Food is food. Some we need more of and some we need less of. It's not about starving you. It's about starving your fat cells. Bariatric surgery is another tool we have available to help you on your weight loss journey. It's something we discuss with patients who have a BMI greater than 40 or a BMI greater than 35 with a major comorbidity like hypertension or AFib. Bariatric surgery is clinically indicated for some patients, just like medication for sustainable weight loss. We work closely with our bariatric surgeons to provide you a unique, comprehensive approach that is like no other in the nation. Bariatric surgery and medications are both tools that, if properly used in conjunction with diet and exercise, can lead to sustained long-term results. But neither is essential for weight loss. Developing the best plan for success, specifically designed for you, is our #1 commitment. In order to start the program, your BMI must be 30 or above. Here's some good news. Most of our patients' medical visits are covered by insurance. Keep in mind, you may have co-payments each visit depending on your insurance plan, just like any other doctor visit. If you are on Medicare, you are eligible for 1 visit every week for the first month. Then 1 visit every other week for months 2 through 6. During months 7 through 12, you are eligible for 1 visit a month if you meet the 6.6-pound weight loss required during the first 6 months. Every patient, no matter what your insurance, will be charged a one-time only program fee of $99 that is due on your first visit. That fee covers an evaluation with our exercise physiologist, a body composition analysis on each visit, an FDA-approved basal metabolic test to evaluate your current metabolic rate, and a variety of meal replacement snacks to try. Now that you have a clear expectation of our program, you can see how we are here for you throughout your entire weight loss journey. All you have to do is take the first step. Remember, our goal is to help you reach your goal.